Welcome to the crew welfare panel. In this panel, we will be discussing about mental health and crew welfare. And it's a fact that mental health and crew welfare have been the center of this COVID crisis, inevitably. This crisis has actually posed a lot of challenges to the industry and all the stakeholders across the globe, not only for those who are sailing with the ships, but also for those who are not sailing with the ships, seafarers who are in their homes, and of course, a lot of parties involved in the operations of the ship. IMO think there was a day of seafarers outlined and seafarers as key workers, and seafarers are our family. We have to bear this in mind, and we need to join our forces and cooperate a little bit better with respect to the crew welfare. Now, in this session, we will be discussing on what is going on and how we can improve. And in this session, we will be joined by Kostas Karavasilis from the UK P&I Club, Ross Millar from Steamship Mutual, Joan Smith from Sailor Society, Athina Stoupis, representative ShipMed Care, and Yves Vanderbon from Standard Club. And what we're going to do, we're going to start right away with some opening statements and presentations from each of the panelists, and then we'll dive into a discussion. And we would like to start right away with Kostas Karavasilis of the UK P&I Club. Kostas, the floor is yours.
Yes, good morning, everybody. Apostolos, thank you very much for the invitation, and let me say to all of you that you are watching this, that crew welfare is a very, very important thing nowadays, and the only good thing that actually COVID-19 pandemic was to bring forward the neglected, let's say, issue of crew welfare. So let's start the presentation. So, seafarers, the maritime industry depends heavily on seafarers, and the seafarers bring the human element in shipping. As per latest Allianz Safety and Shipping Review, 75 to 96% of incidents on board leading to accidents can be attributed directly to human error. And the human error can be disguised in a variety of underlying problems such as fatigue, poor mental health, stress, and other issues. So, we have a very useful tool, the Seafarers Happiness Index, that actually assists us to comprehend and appreciate what's going on board. Just for those who do not know what is this, it consists of a standard set of 10 questions which do not change, and the ongoing levels of satisfactions are marked out of 10 and can be cross-analyzed. The results are published quarterly. Here we can see the latest results that they were published in last October, 10 days ago, and we can clearly see that the index has fallen almost 7% since Q3, and it is the lowest within 2020. And most probably, this is because of the COVID-19 pandemic. We can see also from previous editions that the happiness index had been increased, but gradually decreased, and it started also from the second quarter of 2020 and keep decreasing. A very alarming trend that was found recently is that racism and bullying on board have been increased. What is very useful to understand is that the happiest crew members on board are the older crew members that presumably are accustomed to the harsh conditions on board the vessel. They know how to deal with it. They've been there before. So younger crew members are happy, are less happy, I would say. And of course, something that we all know, the least happy crew members on board are those between 35 to 45 years old, and these are usually the guys, the crew members that actually wait their promotion, let's say. So we see that chief officers and second engineers are more stressed on board and are less happy than, let's say, a fourth engineer or a third officer or an AB, that they do not wait many things to happen to their career soon. So these guys, between 35 and 45, are eager to show more. They are stressed by not only the captains, but also from the office. So to perform better, and they have many duties that you do not have when you are a junior officer, let's say. Moving forward, an issue of our times is the shore leave. So we all know that there is a lack of qualified seafarers worldwide. So that means that we have a quick turnaround of crew between contracts. That means people do not have time, to take a proper long leave in order to rest, not only physically, but mentally as well. Another issue is that nowadays terminals are far from the cities, so it is very difficult for a seafarer to go out and spend some time ashore, changing his environment. I left last the COVID-19, nowadays COVID-19 restrictions, that many ports around the world do not allow crew members going ashore due to quarantine and in order to maintain low COVID-19 cases. So all this make seafarers feeling trapped on board their vessels, and this leads to their stressors, to become high. So let's see a bit about suicide, which is something that has come recently, let's say, to the industry standards. The World Health Organization indicates that 800,000 people annually die due to suicide. And the suicide is the second leading cause of death among people between 15 to 19 years old. The first one, for your information, is car accidents. So what actually leads to suicide is either conflict, disaster, violence, abuse, loss, sense of isolation, or a combination of those. So the Swansea report indicates that seafarers are the second most risk professional worldwide when it comes to suicide. From 1960 to 2009, confirmed suicide cases account for almost 6% of all deaths at sea. But we do not know for sure if this is the case, because 83% of alleged suicide or possible suicides have been occurred at sea. I mean by drowning, going overboard either at sea, at port. So,
your time
yes,
is
please.
Up. The time is up, actually. You have to conclude the presentation. Actually, the presentation just went away. Do you have anything else to add? I'll give you some seconds to give, because we have to stay in pace with the 5 minutes, and we have to stay in pace in order to conclude the session in time. Do you have anything else to add? Because we don't see the presentation, we can see you, however.
Yes, just very quickly, I would like to say more about the suicides on board, that the IG do not actually give statistics as far as suicides are concerned, and this is due to the fact that we do not know if deaths are suicides and vice versa. And of course, there are crew members coming from certain cultures from the world that they do not apprehend the suicide as an act. And finally, I would like to say that there are many organizations that actually assist members on board, and I presume that the rest of my esteemed colleagues will go further on that. Thank you very much.
Okay, thank you. And I'd just like to as we are, the next presentation will be from Ross Miller. I'm just gonna mention that it has to be brief within the 5 minutes time frame because we will be out of time at the end of the session. And as we expect for the presentation of Ross, I'd just like to remind you that you have to double click in order for the presentation to go live. Ross.
Thank you very much. Crew welfare can be appraised from several points of view: legal, insurance, and regulatory, to name a few. But in truth, there are many more, all relevant and all important. But where does that leave the seafarer or their loved ones? In our opinion, the most important viewpoint is that of the seafarer, and many are currently feeling isolated. There are various frameworks to assist and protect them, but despite pressure from various international bodies, the rules and procedures currently in place have made welfare issues difficult, complex, and problematic to solve. There are over 10 separate areas of welfare covered within MLC 2006, spread throughout the various titles. With the introduction of COVID legislation from governments, this has obviously affected all welfare issues, crew change and repatriation being among the best known examples circulating in the media. This has meant seafarers' contracts have been extended, some with leave dates being pushed back, or worse, those dreaded words, to be confirmed. And this has amplified feelings of isolation among fleets. A feeling which is equally felt by seafarers at home, who have been marooned until they have the opportunity to join vessels, many of whom have no income until they do so. The media has also reported on some methods used in an attempt to enable crew members to pay off, such as the utilisation of lifeboats. And tragically, this has ended in loss of life for some. This further highlights the desperation surrounding this particular issue. You can see here the MLC ratifying states. The animation then shows flight information by state with no, partial, and total flight restrictions. But what are the other issues cited in MLC? What would happen to the seafarers, to the standard of seafarers' food, should the only cook on board become infected? I'd suggest it would invariably go down. For those in the panel who've been at sea, we all know that a good cook can make the trip more enjoyable and assist strengthening morale on board. But it's much more than that. Through their work, they ensure seafarers have the best chance of eating a balanced and healthy diet on board their vessels. This issue highlights manning levels on modern vessels, which, largely due to technological advances, means ships now have less crew on board. So even if a single crew member reports sick, this invariably has a massive impact on the hours of work of the various other departments on board. But we've spoken briefly about welfare on board ships, but what of the welfare infrastructure shoreside for the people that you can see in this slide? Shore leave has long been considered a benefit of working on board ships, and from a personal perspective, I always used to enjoy stepping ashore, calling home, and exploring a port. This is all stopped under local government COVID legislation. Seafarer centres are normally located near ports and are hubs for crews and provide an opportunity to relax and enjoy some much needed time away from vessels. They offer a range of facilities such as shopping and entertainment, medical facilities, and importantly, a stable internet connection, something which many people shoreside take for granted. With these facilities gone, the feelings of isolation have only increased. In addition, welfare visits to ships have also been stopped, again cutting a vital service for seafarers. More positively, we are beginning to see flag states and port state control MOUs updating guidance on welfare. Some have responded by recognising seafarers as essential workers, allowing them to travel to and from vessels, albeit with some restrictions imposed. The opening of a small number of welfare centres has further eased the feeling of isolation which has been experienced by so many over multiple months. And additionally, some welfare visits permitting crew the ability to confidentially speak about any concerns they may have about their own welfare are being allowed. However, we believe that much more needs to be done to bring the support structure back up to and ultimately exceed pre-COVID levels. The spread of the disease has fundamentally changed the way we look at ourselves. But while populations have been locked down in their own homes, seafarers have continued to operate in some extremely challenging and stressful conditions. They should be recognised and applauded for this. Thank you.
Okay, thank you very much, Ross. And as we are preparing ourselves for the next presentation, I would just like to ask you if you have anything else to add with respect to, for example, what do you think what's the key impact out of what you mentioned for the crews on board? Just your perception.
Yeah, I think there's a great stigma. Certainly when I was at sea, which, I mean, about 15 years ago, doesn't seem like long ago, but there was still a stigma attached to talking. And I think it's important to educate people to be able to break that stigma. And it can be something as simple as just talking to somebody on board about your feelings. And I think that is important, particularly now more than ever because of this feeling of isolation. But also, if the opportunities are there, the ability to use the kind of modern communication systems to speak externally to either professionals, family members, or just somebody to listen. And I think that is important.
Okay, thank you. Now, the next presentation is from Johan Smith. Johan, the floor is yours. You have to double click in order to initiate the presentation.
Good morning, and thank you very much for the opportunity to briefly share a few thoughts before we go into our panel discussion. I think we are all on the same page with regards to the really tough circumstances seafarers are facing right now. But I do think that this tough circumstances are really assisting us or presenting us with a very unique opportunity to create a well-being and mental health management system for our industry. In my mind, there's a few things that are very central in creating such a management system. First of all, I do think that any input from our side should be of a holistic nature. Long gone are the days where we thought of well-being and mental health as purely an imbalance of chemicals within our bodies. We now acknowledge it as a complex set of factors, including who we are as social, emotional, intellectual, spiritual, and physical human beings. And something about our approach must reflect that complexity and acknowledge the multidimensional nature of what is a very, very complex topic. It is about interconnectedness and how different things influence one another. And it is not only about the self, but also on a larger scale, how we are connected to our communities, to the political world out there, to what is currently going on. And any system should take that into consideration. In creating a management system, a well-being and mental health management system for our industry, I think the road forward is to work in collaboration. There's such a lot of brilliant organizations out there bringing different expertise to industry. And it is important that we learn from one another and that we take the point of view that we are stronger together. I think it is also important to emphasize continuity of care. If there's one thing that is clear from COVID-19, it is that a one-dimensional approach, sort of a once-off training or a helpline, will not cut it. Continuity of care is concerned with quality of care over time. It is about working as a care team, working with seafarers to cooperatively work together to establish good mental health and well-being over a period of time. It is, in other words, not just reactively thinking about mental health, but thinking about it in also the proactive sense of the word. Then, fourthly, I think we can dream up grandiose schemes of how to address wellness and mental health. But first of all, we need to do the basics right. Some of the basics of good well-being and mental health is things like sleep, food, exercise, drinking water. And if our approach do not consider these very basic things, I think we will come up short in the end. Second to this, if I can move on just to my final slide, I think the aim of this should be a multi-dimensional, sorry, I don't know where my slide went now. It should be a multi-level intervention that builds awareness on multiple levels. It is not enough to merely educate crews about mental health and well-being. Management should be involved. There should be an understanding on the side of the shoreside staff to really comprehensively understand the challenges that seafarers face on a day-to-day basis. Then also, I think it is important that this system emphasizes facts and that we do away with a lot of myths that are currently going around in the industry. Awareness can do this, a multi-level awareness campaign where we make sure about the facts. Of course, such a system should take culture into consideration. We come from a wonderful industry that is multicultural, and it is significant to understand well-being and mental health from different cultural perspectives. There's richness in every culture on board a vessel. There's ways in which every culture copes with these topics. And it is important that a comprehensive system managing these things will also draw from these cultures. And then lastly, I think we have the biggest challenge of all, and that is that our approach should acknowledge that family relationships are one of the cornerstones of positive health. How do we in industry ensure that seafarers on board their vessels can build and maintain positive relationships with those back home?
Thank you. Johan, thank you very much. Do you have anything else to add as we are expecting the next presentation to appear on the screen? Do you have anything else to add?
That was literally my last sentence, so you caught me just in time. So that's it for me. I'm looking forward to the rest of the conversation. Okay. Thank you very much.
Thank you. Our next presentation is from Dr. Athina Stoupis. Athina is representing SIPMED here. Athina, the floor is yours. You have to double click in order to initiate the presentation.
Okay. So good morning. I'd like to thank the organizing committee of the SAFETY4SEA for this invitation, as well as Dr. Tsardis and Ship Medcare for inviting me on this panel. Ship companies have to have a plan of action in order to prevent COVID-19 disease on ships and to know how to address issues if there is a COVID positive patient on board. The International Maritime Health Association has developed these 5 steps as recommendations for crew members that are to board a ship. Basically, the crew member should have a test in his home country. If it's negative, he proceeds with journey. Then when he arrives in the country 3 to 5 days later, he should have another COVID test performed, and he should quarantine for 14 days prior to boarding the ship and have another COVID test just at the end of this 14-day quarantine. Of course, when boarding, verbal or written screening should be performed to determine whether persons have had signs or symptoms of COVID-19 or a known exposure to a person with COVID-19 within the past 14 days. Various questionnaires have been distributed throughout different companies in order to perform this. And of course, many ships are now using onboard COVID-19 testing. There are 3 types of tests. The molecular test, which includes real-time PCR, which is mostly performed in laboratories on shore. Rapid PCR, which of course can be performed remotely. These are more accurate tests in compared to the other ones. COVID-19 antigen test is also performed using a nasal swab. It's practical, it's rapid, but you can have a higher percentage of false positive, false negative tests. And there's an rapid antibody blood test looking for IgM and IgG. It is not recommended. It's mostly used for epidemiologic purposes and is not very good at detecting acute infection. And so it should not be routinely used. Of course, persons who are test positive should not, or have been in contact with someone who is COVID positive, should not be allowed to board on the boat. In this slide, we can see that in the middle, the sensitivity is high for PCR tests, meaning that false positive and false negative tests are less likely, whereas the antigen tests, a false positive test is more likely. And therefore, ship companies should not solely rely on COVID testing, but should also educate their crew members about the symptoms, and they should be reported immediately to the master of the ship. What are the symptoms? Everyone pretty much knows by now: fever, dry cough, tiredness, less common symptoms, aches and pains, sore throat, diarrhea, conjunctivitis, headache, loss of taste or smell is characteristic. And if serious symptoms arise, such as shortness of breath, chest pain, loss of speech or movement, these are serious symptoms that need medical evacuation and medical attention immediately. Of course, if someone is tested positive on board, they should be isolated. I think all the ship companies know by now the person should be in an isolated cabin room with the door closed, and designated persons should go in and out with personal protective equipment. I will not tire you with all of that information, which everyone knows. Medical management, of course, medical staff should be notified of a COVID positive patient on board, and this includes telemedicine providers. The patient should have increased fluid intake, cough suppressants, paracetamol, mostly supportive care, and they should be monitored for worsening symptoms. If they have a respiratory rate above 20, then the person should be evacuated immediately and hospitalized. The CDC gives 3 different types of plans if there is a COVID-19 breakout on the ship. Option 1 is crew change out, where the entire crew is taken off the ship, left on 14-day shoreside quarantine. The ship is disinfected and new crew embarks the ship. There's an option 2 is working quarantine, where the people stay on the ship. Those without symptoms continue working. The ship is disinfected, and the patients that have symptoms are isolated in their cabins. And the 3rd option, of course, is to temporarily discontinue operations, meaning that the ship is docked or anchored, and the crew remains on the 14-day quarantine on the ship. And of course, the crew members that are symptomatic remain isolated in their cabins while the other crew members continue preventive measures. So it is really many organizations, international organizations have given different guidelines on how to face COVID-19, both with preventive measures and guidelines on how to avoid major outbreaks on the ship. I think that my final statement is that the ship should not rely heavily on testing, but also need to monitor for symptoms and educate the crew on how to prevent and manage COVID-19 disease on board. Thank you.
Okay, thank you, Athena. I would like to ask, because you mentioned these protocols of how to handle these cases, from your experience, do you have any real-life incident of handling these similar cases, I mean, COVID-19 cases on non-cruise ships, and what would be key challenges from first-hand experience? Do you have any sort of feedback, that sort of feedback?
Well, when we have someone with COVID-19, if they don't have major symptoms, we tell them to isolate at home. And in the hospital setting, when we have healthcare workers who either have been in contact with a COVID positive 19 patient or they themselves have symptoms, have to be removed completely from the hospital and then retested at 7 days to check if they are COVID-19 negative before re-entering the healthcare system. Although CDC recently has made a statement that once someone is positive and if they are asymptomatic or they have only mild symptoms, they can return to their workplace or be removed from quarantine 10 days after the last symptom, being fever or whatever other symptom they may have. So this 10 to 14 day time period, even though their COVID test may continue to be positive, allows the person to return back to their place of work.
Okay, thank you. Now, our next and actually final presentation for this panel is from Yves Vanderboom. Yves, the floor is yours. You have to double click in order to initiate the presentation.
Sorry, thank you, Apostolos, and thank you so much for inviting me as well. Let me try that again. I wanted to have a bit of a talk on some of the other topics that my colleagues from Steamship and UK have not talked about yet. And on one hand, that is the pre-employment medical exam. It sounds a little bit maybe normal, or why should we talk about a PME? It needs to be done. But strangely enough, what we are seeing during this COVID period is again some people trying to get away with this quite important test prior to joining. We found one seafarer on board who had an illness unrelated to COVID, and he managed to have gotten on board without a PME test done. It's something that is still ongoing. We're still looking into how he managed to do so, but it happened. We found another case, which is a little bit closer here in Asia, where a seafarer was transiting to another country for boarding the ship. He had cleared the COVID test prior to embarking on the plane, but when he arrived here, he was still found positive. Clearly, something was wrong with the initial test that was done in his home country, and the whole batch of crew that was traveling together had to be sent back home. So there are still people, or manning agents, I should say, that are trying to get around this requirement just in order to be able to get crew on board of ships. So just a shout out, PME tests important, definitely recommended as well to do enhanced PME tests to make sure that there are no other issues with the seafarer before joining. A lot is being said about mental well-being today, which I think really is important, but I don't want people to forget about the physical well-being. You can only be as healthy as you feel good in your own body. If you are not physically healthy, you're not mentally going to be happy either. There is always a reaction for crew when they are being stressed by the current situation, for example, on board, to resort to having comfort food instead of having the healthy food. So important for the crew, the chef on board, the cook on board, to provide healthy food. Similar, there is a really good positive aspect of communal dining. I will talk about it a little bit more in the next slide, where people are not coming together on board of ships. There is the social aspect, which is really important. So social aspect of communal dining, very important. Exercising on board, and hopefully a little bit better equipment than I put in this picture, that should be provided on board of ships for crew to stay active, to make sure that there is some exercise done at least, and for owners and managers to think about how to incentivize the exercising on board. I mentioned social well-being. These days already, we know that crew is going on board with smart devices. We know already that they are going in their cabins after they finish work or after they finish their meals. This COVID has made it even worse now because they are afraid that they will contract the virus from each other on board. They are becoming even more antisocial, and this builds onto the whole negative feeling that crew has, the whole mental depression that they may get. To stress how important it is that when you can talk about a problem, be it to people like Sailor Society or Mission to Seafarers, or to your fellow crew on board, it's really important that you can open up and can talk about any bad feeling. It doesn't need to be a depression, but about anything that the crew can feel. This is a little bit of a double-edged sword when we are talking about internet connectivity on board of ships. It was mentioned earlier, the importance of the family connection, and I fully agree with that. I think certainly now during the COVID period, it is important for the crew to be able to be aware of what is happening with their family back at home. But at the same time, the other end is that if they are receiving too much information from their family, it's also not good, because that is going to take away their focus from the work that they should be doing while they are on board. So I think there it is important that ship managers or ship owners educate the families ashore what is okay to tell your partner at sea, what is not okay, and set up a support network for the family so that they can go to that support network for advice instead of burdening the seafarer with the problem. Of course, internet connectivity also has the usual cyber risks, and it takes away from onboard socializing. So in general, I would recommend to limit internet connectivity except for where really required. One last shout out to a series of posters that we made at the club a couple of years ago, where we stressed the importance of the physical and the mental and the social well-being. And I'll be looking forward to the awards later where we are nominated. So I'll look forward to the results. Thank you, Apostolos.
Thank you very much. I would like to start our discussion by asking the same question to all our panelists. I would like to start by asking, as an industry, what have, out of this corona crisis, what have we learned so far?
The only thing that happened is that the problem of the crew welfare, crew well-being, and crew's emotional and physical status was just put under the spot because, as I mentioned before, and I presume that all the rest of the panelists agree, these issues were kind of neglected. And I would say more than that, saying that when I was at sea, I left ships back in 2009, having spent 15 years on board, reaching to the rank of the captain. I would say that before that, we didn't, pay attention to what people were thinking on board, and we were not paying attention to theirs and to ours well-being. That was something, we used to say on board that, okay, this guy that seems to be, somehow is not for the job. But apparently we were affected as well. So I think that COVID-19 pandemic gave us the opportunity to bend upon this problem, these issues, and from now on, they brought these issues to the spotlight, and it is a good opportunity for the whole industry to start taking care of the crew members, not more because everybody cares about the crew members, but, you know, to identify their issues and try to find solutions in order for the crew members to be happier and more productive, and actually to take the industry to the next level.
Okay. Ross?
Yes, I would mimic what Costas started off with there. I mean, I think seafarers' mental health. I think mental health in general is getting far more of a spotlight now than ever before. And I mean, going back to the time, I said it just after the presentation. I mean, when I started at sea, I always felt there was this stigma that I referred to, and I was lucky enough. I sailed with a captain who actually took great delight in speaking to people about their problems, not just speaking about work, or he would literally just speak to you as a human being and just ask if there was any problems, anything at home. And I think that really for me was a kind of turning point. And I actually thought to myself, well, actually, it's okay to talk. And I think the more people that are educated, but by viewing things like this, they can even if you reach one person who's been able to talk, who actually thinks to themselves watching this, actually it is okay to talk. I can go and talk about a problem that I'm having, and if that's as a result of educating them, then so much the better. Because it is a problem. But as I said, I completely agree with Costas that in very much a similar vein as the technological advances that people are using now, like Zoom, Skype, to communicate with loved ones at sea, and not just at sea, but all over the world. It has been vital for people's mental health, and as a result. Mental health issues of seafarers have been, they've come to the forefront because of this disease in a similar vein to the kind of technological advances that have assisted or can assist with their mental health.
Okay, Johan?
Thank you very much. I can only agree with the two previous speakers in saying that all that has really happened is that an issue within industry that is as old as the industry itself has now been highlighted. COVID has really catapulted the whole issue of well-being and mental health to the top of the agenda. I think what it has done is it has asked questions, prompting questions as to our response in terms of mental health and well-being. Companies are under pressure to answer these questions, flag states, the IMO. So what it has done is it has asked questions on the type of response, and it is challenging us to engage with welfare, with wellness and well-being in a new way through creative solutions and thinking outside of the box on how we can actually assist seafarers while they are at sea on their vessels to ensure that they proactively take care of their mental health and their well-being.
Okay, Athena?
I think that with the COVID-19 scare and all the precautions and the testing that's being performed, I think that many crew members may have a lot of anguish as to whether they can possibly contract COVID-19 on board the ship. And I think that they need access to medical staff and be well educated on the symptoms, and also be comforted that in most young people, and most of these crew members are young, healthy individuals, COVID-19 usually is mild. And even though drastic measures are taken to isolate people, and we don't want them getting sick, but on the other hand, they also have to understand that it is a virus, that it can be mild and or even asymptomatic in most people, and they have to have access to medical staff or personnel, either through to have their questions answered when they have certain symptoms. I think it's really important. It creates a tremendous amount of anguish, especially either when they're waiting for a COVID test or if they have even, I think all of us today, even when we have a bit of a sniffle or a cough, suddenly we say, oh my goodness, is this COVID-19? There's mental anguish that comes along with it, but it can be isolated, a closed ship, a closed population can be monitored and very much better than any other area onshore. And I think that that's important to let the crew know that the ship company is looking after them and that everybody's being tested and everybody's being monitored. And this level of comfort should be given to the crew members.
Okay.
Then, of course, if something serious happens, the ship needs to know what to do. A plan of action needs to be in place. And if somebody is seriously ill, they have to be immediately evacuated, and medical staff has to be notified immediately, of course.
Okay. Eve?
I agree with what has been said already. I was trying to think about something different to say. And I feel one of the things that we have learned out of this COVID is that the world has a wrong perception about what shipping is. People do not understand what it is that seafarers do. The shelves in the supermarket are still full. So why are we all complaining about it? People just don't understand. So I think that's one thing that really would need to change. The world needs to properly understand how important it is that the work that seafarers are doing. Because in the end, how do we want the next generation to agree and to say, oh, that is a profession I really would like to go and do in the future, if the only thing they can see at the moment about seafarers is the discrimination and the way seafarers are being treated at the moment. Thank you.
Okay, we have just for the sake of discussion, because I fully endorse what you say. However, we have to bear in mind that the industry has a low profile on purpose. That's a side effect of what commercially is going on in the industry. A lot of corporations are established in several offshore places, and the industry itself has a low profile. If we do not raise our profile, then the industry will not be let's say, a good destination for the young talent. I'm saying the example of a good German friend saying to me, I'm working with Siemens, I'm working with Bosch, I'm working with Mercedes, I'm working, stuff like that. These industries and these corporations have a raised profile, and they do not prefer to go and work, for example, with Hapag-Lloyd, despite the fact that we, as shipping, consider Hapag-Lloyd, just for example, is a big name. For those who are raised in Germany, this is not a big name. The big names are the Mercedes and the Siemens and so on and so forth. So as an industry, we have several challenges as long as we keep this low profile for a number of reasons. But I'm just saying this is one of the side effects of what is going on in the industry. Now, I would like to take the spotlight out of the seafarers on board. It was mentioned in the previous panel. One of the hidden, I would say, challenges is for those seafarers who are not on board for the time being. There's a huge challenge for those guys. There are people who are stuck ashore for 6 months, maybe 1 year. They have run out of money. They have several challenges that they have to face. What about these guys? I understand that there are a lot of seafarers stuck on board. Kuba in the previous panel mentioned something in the range of 700 to 800,000 crew changes not affected so far. Yes, seafarers on ocean-going ships are something in the range of 1.5, 1.7 millions. Okay, it's a huge number, what we have to face, but there are hundreds of thousands of seafarers stuck ashore. How about these people? Kostas.
Well, this is an unfortunate thing, and I believe that many companies nowadays, they have a minimal salary for the people who are not working on board. I had the pleasure to work for this kind of companies, both Greek and international. So that was well before COVID-19 pandemic. So they took care of the seafarers working for them. And I believe that many companies nowadays operate this way. Unfortunately, this is an unprecedented condition, and we have never faced that before. So I think that unfortunately seafarers have to be patient, because this is something global. Let's take, for example, what's going on in the airlines industry, where people get fired. So yes, I believe that well-established companies that now actually drive the industry, they do take care of the seafarers working for them. And as you said, there are 700 or 800,000 crew changes that are pending, and suddenly when this eases a bit down, and I believe that's going to be sooner rather than later, this will come back, to normality as much as possible.
Okay, Ross?
Yeah, I mean this is it's heartbreaking to see them all ashore, because obviously, as Costa said there, the kind of major ship owners have agreements in place which will assist seafarers who are ashore, but smaller ship owners obviously struggle, or perhaps may struggle in dealing with this. And I think, obviously, we've seen in the media crew changes and repatriation of seafarers who are actually on board. But I agree with the point you'd raise that there has been very little said about the seafarers ashore, because for every seafarer coming off a vessel, one needs to go on. And they obviously, I think I obviously mentioned that in my opening remarks, that it is a problem. And again, it's an incredibly complex problem, and I don't think there is one solution for it. I think it's a range of options, packages perhaps offered by the shipping company, or potentially the states involved, because at the end of the day, these people have families, they have homes to pay for, and it's a very, very real concern for them. But again, they could perhaps approach their agencies, the operators, and speak with them, and ask them about options available to them, and really, as a starting point, take it from there.
Okay, Johan?
At the Sailor Society, we've talked extensively about seafarers who are stuck at home, and we are doing this because our call lines, or our helplines, are getting more and more calls from seafarers who can't get a job, who can't join a vessel, and because of financial problems and also mental health issues, not being able to provide for families. We foresee that this problem will grow significantly in coming months. What we've done from our side is we have set up helplines that are not specifically or only aimed at seafarers on board, but also aimed at families. And we encourage families to reach out to us, and also seafarers back home. We've got a few family outreach programs where we try to reach out to the seafarers in various ways. Some medical sort of interventions, all sorts of ideas to try and assist these seafarers stuck at home in a very small way. Further than that, I think there's some welfare grants available at the moment that can practically assist seafarers who are unable to join vessels at the moment. I think the biggest concern is that the funds to do something like that is, of course, extremely limited. But from our side, and I believe other organizations as well, are very aware that this is a massive problem at the moment, and we are thinking and engaging in different ways to also reach out to those seafarers.
Okay, Athena, you have to unmute. Athena, you have to unmute.
I think that each country has their own restrictions and preventive measures for COVID-19. And of course, people that are stuck on shore have to adhere to the different restrictions of each country. But as I mentioned in my presentation, many international organizations are giving guidelines on how these crew members can eventually board a ship when the opportunity arises, and they should be aware and educated, first of all, of their symptoms, and second of all, where testing centers are when they're on shore, and so that if an opportunity arises for them to board a ship, even though they're on shore, they need to know how to proceed with actions to do that. And of course, if they're not on a ship and they're on shore, they have to adhere to the restrictions like the rest of the population. And I agree totally with having some kind of helpline or some type of a way for these people to have access to medical attention if they need it, both financially and practically. I think the ship companies should provide the access to healthcare while they're on shore, especially if financially they're not being supported as well as they would have been if they were working on the ships.
Okay, Eve?
I agree with what has been said. I think it is important that companies are setting up a support system. I think the bigger companies are putting up some kind of a salary advance scheme in place for their crew. I don't think that many are doing so. I think there are quite a number of crew who would not want to go back anymore, or where the family doesn't want them to go back to sea anymore because of everything that is going on. One thing I would add to what has been said is that companies need to have a really open communication. It's not just about giving support to the family or the crew ashore, but they need to have open communication. Let it be clear to those crew ashore, when is the first chance to be able to go back? When is your family member coming back home? So from talking to other organizations like Sailor Society or Mission to Seafarers, we know that one of the main feedback that they receive from the families ashore is that they keep trying to call the manning agents or the crewing departments, and they just fall on deaf ears. There's no updates, no nothing. So that is my main point on it.
Okay, now I would like now to, as we move forward, we've seen the industry responding in a number of ways. Several stakeholders are responding in a number of ways. We've seen some of these stakeholders responding effectively. I would just like to mention the flag states, the classification sites, the insurers, of course. They have responded more or less extremely effectively to make a seamless transition of how to handle the problem. However, we've seen other stakeholders, such as port states, such as, for example, charterers, such as, for example, the airline industry, not being so supportive to the crisis, and the industry is asking for some sort of bubbles, some sort of corridors, let's say, of how to affect the crew changes. Now, given the fact that the whole crew change thing we are discussing about is a key issue, I would like to ask you, so far, from what you've seen so far, what have we learned with respect of where we have been successful on handling this crisis, and what would you like to see moving forward in order to have this crew welfare we are talking about being improved as we move forward? What would you like to see in order to have this crew welfare issue improved as we move forward? What have we learned? How can we improve that? Kostas.
Well, to my mind, the shipping industry responded very quickly and swiftly, taking into account what's going on worldwide. I think that certain industries, such as shipping and the aviation industry, should cooperate more and to be coordinated by international bodies such as the United Nations and International Maritime Organization in order to assist at least the repatriation and the crew changes all over the world. Recently we saw that China opened 10 ports and in order to be able to repatriate crew members, and certain changes are being made around the world, but these are not coordinated, and these are coming from certain states. So I think that certain industries that actually move the world trade, let's say, to sit down and having an international body as an arbitrator, if I may say like that, and coordinate their moves in order to be able to assist as far as repatriation is concerned. Now, what else we learned from this pandemic is that actually we didn't learn. We confirmed that shipping industry reflects better than other industries. It is stronger, and the people work within the industry, are due to the very nature of their occupation, are harder, and they can cope better with this kind of uncertainties. Of course, this has a toll to their mental health, and of course, as I said before, and as the rest of the panelists pointed out, now we have to deal more with crew members and not only, and their families' well-being.
Okay, Ross?
I think, taking firstly the point about the aviation industries, I think at the end of the day, regardless of what industry you're in at the minute, you are very much at the mercy of national regulations from each country. So I don't think it's a fact that airlines didn't want to fly. I think it's a fact that they were forced to because of the regulations, which have been adopted by various administrations throughout the world. So I think, like I said, it's not that they've not wanted to fly. They've been very much at the mercy of it, the same as ships have been at various ports around the world. So I think the industry has adapted. I think, as you said, some flag states were criticised in the media for not acting swiftly enough, and I think it would appear that that's obviously been rectified by a number of port state control MOUs and flag states issuing further guidance on crew welfare and getting things like repatriation moving. I think one of the other things is going back to where I would personally, I would like to see risk assessments and plans put in place to get back to where we were pre-COVID, because the likes of opening seafarer centres, it has been done in some areas around the world, and if it can be done there safely, then I would question why it couldn't be done safely in other parts of the world. Obviously, the problem is that because of the way the disease is spreading, governments are having to take action, and obviously quite rightly so, to protect populations. But equally, I don't feel seafarers should be forgotten about just because they are not part of the population. They are contributing in another way to the population of that particular country, and I think it should be high up on the agenda of many countries to allow seafarers the same kind of dignity and respect that they're giving their populations by trying to protect them. But again, just my last point, just the opening of welfare centres again would be very welcome. And as I said, if it can be done safely and risk assessed, then I would like to see it happen. Yes.
Okay, Johan, you have to unmute.
I think a lot has been said about seafarers being key workers, and I think now is the time to take that message further. There was a lot of emphasis, but my question will be, in 2 years' time, when this is gone and forgotten, will seafarers still be key workers? I think now is the time to translate seafarers as key workers into regulation, which will ultimately influence national law and as a result port state law and flag state law. So from a regulation point of view, I'm hoping that seafarers will receive a different status. And also from a regulation point of view, I'm hoping in terms of well-being and mental health that the MRC will get a bit more flesh relating these issues. Talking about the mandate of different companies, flag states, organizations, and what these organizations must do in terms of well-being and mental health. In our case, we are now back in port in Africa, in Brazil, in Europe mostly. It is really only in Asia where our ship visitors are not yet allowed back in port. So we are hoping to get back on vessels very soon. But in the meantime, I think a new way of looking at welfare and well-being is to provide assistance even if you don't have access to port. Technology is making new things possible, reaching out to seafarers while being at sea, and I think that is the direction that it should go.
Okay, Athena?
I have too much more to add to what the previous speakers have said. I do know that IMO, the International Maritime Organization, has updated versions of specific guidelines on how to respond to COVID, dealing with the welfare, the medical welfare, not only the mental welfare of seafarers. And I think that if since they are international guidelines, if the various ship companies could look at those documents as a guideline, I think it would be helpful in dealing with the crisis, rather than having each company have their own, which they do have to have their own regulations. But if all the companies follow the general guidelines, and then of course the international ports also look at the guidelines, perhaps a more unified approach to how to deal with COVID-19 for seafarers would be available. But it's easier said than done, of course. But these guidelines are available, and I think that ship companies should adhere to them, regardless of which company they're at, or which country they're from, or where in the world they're sailing.
Okay, Eve?
Crew welfare has been an issue for some time. What we can say thank you to COVID is that it has put a spotlight on the crew welfare. There's nothing new that needs to be done. People know what has to be done. I agree with the various items that were said. One thing I would add is that I feel it is time for the authorities to come together and talk about minimum operational safe mannings. There is still way too many ships that are sailing with minimum safe manning crews. In this period where everybody is tired, where there is fatigue, how do you want a crew to operate the ship if they are sailing with minimum crew? So I would really want to stress that owners need to, well, to be blunt, don't be so stingy with your crew. Make sure that the crew has a proper accommodation on board where they can have recreation, exercise, socializing, instead of designing ships with more cargo capacity. I know one company here in Singapore has started focusing on the accommodation and making sure that their crew is being taken care of better. That was just one thing I wanted to add.
Okay, so I think one of the issues that this crisis has brought forward is the need for more guidelines instead of more regulations. But what you are pointing out, and that's an interesting twist to our discussion. You mentioned about minimum operational safe manning, and safe manning has been a buzzword for so many years. We have the issue of safe manning, meaning the number of crew required, the minimum number of crew required from ship to sail from point A to point B. That has nothing to do with the operation, just for navigational reasons. And now you are bringing this discussion forward of, let's say, changing what the industry is thinking about. That's an interesting discussion. Now, I think, that's my personal view, that as we entered this crisis, there was not a lot of voices talking about regulations. I've heard a lot of the word about guidelines and the word cooperation. So I've seen many of the stakeholders and many of the industry insiders asking for more guidelines, more cooperation or better cooperation, and so on and so forth. So my question is, do you think we need more regulation in any of the aspects related to crew welfare, direct or indirectly affecting crew welfare? And if so, in which area would you like to see more regulation? Kostas, I'm not saying we should, I'm just saying, if you think, in which area? If you say, you might say, no, I don't think, we are okay. Kostas.
Wouldn't say that we are okay, but you may appreciate that nowadays shipping is full of regulations that actually affect both the shoreside personnel and the crew members. So I do not feel that regulations will solve the issue. We will just produce more manuals and more checklists for the crew members on board saying, are you happy? Yes, tick, fine, bye-bye. We have the checklist, incorporate it into the ISM, and then goes to the office being audited and everybody is happy, but the crew members. So what we need is understanding and compassionate. We need to think of how it is to work on board. We have to discuss with our crew members after the debriefing, we have back in the office, and to focus on the real problems they have. I don't think that regulations will alter something. I think that this will just create more workload for the crew members on board, and this is one of the bigger stressors that crew members have on board: paperwork, and how to cope with new and daily changing regulations. So yes, recommendations and discussions that will actually assist in solving the problem. I am fond of regulations, yes, but nowadays people actually do not work. They try to follow the regulations. So this is another issue, because when something is over-regulated, it doesn't end up well.
Okay, just for the sake of the argument, someone has to play the role of the devil's advocate. Just for the sake of the argument, MLC states you cannot exceed the 1-year contract. And we've seen people asking how to extend that. And just for the sake of the argument, I'm just giving you some ideas here. Johan, in his presentations, stated specifically the need. I'm just saying, I'm not saying he insists on having this as a regulation. I'm just saying he mentioned the keyword well-being and mental health management system. Someone might say we need a fatigue management system. Someone might say, I'm just giving you some ideas here, we need some sort of regulation in order to have crew repatriated. We need some sort of regulation to force the port states to do this and this and this. I'm not saying we need regulations for the sake of, introducing more manuals and, more ticks and so on and so forth. Regulations may go in a number of ways, forcing several stakeholders to do certain things. I'm just asking if you think we need more regulations, and if you think so, in which direction. I'm not in any way proposing that we need more paperwork or more ticks or anything like that, and just for the sake of the argument. Ross.
But I was thinking about what I was going to say while Kostas was talking, and you've kind of thrown a spanner in the works there. So, for the sake of argument, the likes of, you obviously mentioned the Seafarers Union agreement not allowing contracts to be over 12 months. I mean, obviously, again, ship owners have had, they obviously have adapted, but it becomes very difficult. Like for example, if you're sailing from Asia to Europe during, for example, if you say April, and you had half of your crew getting ready to pay off, by the time they got to Europe, with all the restrictions that were in place, that was becoming impossible because of the regulations that were in play. And obviously, from government's point of view, they obviously have kind of scrambled, if I may use the word, to kind of produce this kind of legislation, thinking about the populations, and that's the point of view that they're kind of coming from. In terms of regulations, I mean, I'm the same as Kostas. Coming from a law firm, I love regulations and law, and a lot of it is covered in MLC. But I think what you're seeing now is seafarers the seafarers have always been resilient. I've always thought so. But you're seeing more creativity coming in from various different branches, social media, for example. I mean, I've seen several videos of crew members trying to not only educate the general population in what they do, which was, I know, a point I think Kostas or Eve mentioned, but they're trying to show and raise the profile of the industry as being a professional, safe, but fun place to work. And so, sorry, in terms of regulations, I think MLC covers the welfare issues and the Seafarers Bill of Rights, if you will. And obviously you're seeing flag states who some were criticised at the start of the pandemic. They're obviously now taking steps to actively manage, and more information is coming out with regards to contract lengths, for example. But it has been very difficult, and it's highlighted another issue with not only seafarers, but it's moving, because of the very global nature of the business, it's moving between state to state. And I think this is one of the big points that ship owners are having some difficulty with, in that things are changing on a daily basis. And for example, if you go to a country that may have state regulations as well as national regulations, you can have difficulty there in being able to effectively repatriate or just perform operations on board. Thank you.
Okay, Johan?
Thank you. Yes, it's an interesting discussion between guidelines and regulations. I think regulation should be the very last thing, but there is a necessity for it. From my point of view, at least, I think working in the welfare industry, it is very true that there's brilliant shipping companies out there adhering to regulations, adhering to guidelines, but unfortunately, there's a small percentage of industry that are sort of the bad apples. And it seems that the carrot stick situation, at some point, there need to be strict regulations to also manage those companies, because there's some irony there If you talk about welfare and well-being, good companies look after their people. They are concerned about mental health, about well-being. But on the other hand, ironically, it is those who are not concerned with it, that's actually the people we want to reach. And how do we do it? We regulate it. And I fully appreciate that the industry is probably already over-regulated. Seafarers have massive challenges in terms of just doing all the training out there, for example. But I would like to see a broader scope in order to, for example, introduce training that relates to well-being and mental health. And I think that's important. Just one last comment. I think what is important is creating a holistic framework to understand well-being and mental health. So what is happening, in my view, in industry is that we are dreaming up a lot of interventions in terms of mental health, well-being, but in many cases it is misguided, it is fragmented, because there's no central framework from which we can understand the human element within shipping. And such as, call it a framework, call it a mental health and well-being management system, call it whatever you like, but such a system creates a standard and it assists us to give a very focused response as opposed to a fragmented response where we try things, but we are not really sure where it fits into the bigger picture. And in areas like these, there's great expertise within NGOs, within insurance clubs, and I'm sure that we can come up with a system like this.
Thank you very much, Johan, for your contribution. And I think you nicely painted out the next frontier, the next challenge for the whole human element discussion. The industry is absolutely fully fragmented on where we should be headed, because we had minimum requirements, for example, in what MLC stipulates. And we have other stuff, like, for example, the new OCIMF human element issues, and the OCIMF and the TMSA requirement, forthcoming TMSA requirements, driving the industry in a totally different way. And as you pointed out, there are needs like those addressed by NGOs, a number of NGOs. And I think that's the next frontier you nicely pointed out. And thank you very much for this. And let's move forward. Athena.
I think that in today's COVID-19 pandemic, many countries are asked to address the new, especially recently, we've had a new surge of COVID-19 cases all over the world. And seafarers are also a part of this world pandemic. And I think that captains and masters of ships are asked to more often than not, they're asked to play doctor. And when a crew member comes up to them and says, I have symptoms, they have to know how to act immediately and isolate the patient and give directions. But I think that perhaps implementing a mandatory telemedicine on these ships might be very helpful. I think that if you have a medical professional giving advice on how to handle these cases on board, I think that's imperative. I mean, even as a hospital, I can tell you that as the infectious diseases doctor of our hospital, our whole hospital system, because I'm at 4 hospitals, I am the person that is called when problems arise. And I think that, of course, the master of a ship is the person that you call when a problem arises, but he needs the support, the medical support of a professional. And I think that that's something that needs to be taken into account, and not just medical advice, but even psychological advice when it's needed, since we're talking about mental health here as well. I think every aspect of well-being should be taken into account, and I think that resources for medical support should be in place. And I don't know if there's a place for mandatory telemedicine or mandatory medical staffing on board, but I think it's something that ship companies need to think about.
I'd just like to state that there are not guidelines, but regulations for mandatory staffing, but this does not apply to the number of crews we have on ocean-going ships. There are regulations from the World Health Organization, but it's not applicable for the figures we're talking about, the 30 minus we have on board most of the sea-going commercial ships. Eve.
Apostolos, to come back to your original question, should we have more regulations? No, I don't think so. I do think that MLC, all the ISM requirements are good. They're just simply not being implemented the way that they should. When I was talking about safe manning, all the good companies, they will automatically put additional crew on board because they know the importance of doing so. The bad companies won't. They will go for minimum safe manning. What Kostas was saying, the crew on good companies or the managers on good companies, they will automatically make sure that there is no tick box mentality on board, that there is not too much paperwork on board. They will do it. The bad companies, they won't do it. So what we need is something for those not so good companies to be pushed to lift up their standards and make sure that everything is being done properly. How can you do it? On one hand, the oil sector did it with the charterers surveys, with the TMSA, with the whole SIRE system. It worked. Okay, there were lots of things that are not that good about it, but okay, it did work to improve standards on the oil sector. Similarly now, I'm actually looking quite forward to how Intercargo is going to make their equivalent of the TMSA and how that is going to affect the dry sector to push their standards up. And if that doesn't work, then I'm going to echo what Johan was saying. He did say it really well. Then you need regulations for those that are dragging behind and that don't want to listen.
Yeah, absolutely. Now, because we have to conclude our discussion, and I would just like to ask a last question to all the panelists. And I would like to ask you, moving forward, this post-pandemic world, what are we keeping? What should be our key priorities? Just give me your buzzwords with what should be our key priorities with respect to crew welfare. Just give me your buzzwords in, let's say, less than 30 seconds. I don't want any sort of lengthy statements. Just give me some buzzwords where we should be focusing post-pandemic. Kostas.
Well, we do not need to focus somewhere. As we all mentioned before, the crew welfare and the crew mental health issues were there. Now it is time to focus, not say to focus, but to take care of our crew members more than we used to do and try to understand them. Not regulation, discussions, and ask them their feelings, what they want to have on board, what they want to be better in order to be able to understand them and assist them in their day-to-day operation.
Okay, Ross?
Quite simply, welfare, collaboration, and engagement. The whole world needs to globally look at this problem, and it's a problem that is very it is of a concern to the clubs, and so much so that as you see, even Kostas with the clubs have done various work. We at Steamship have done various work on mental health. So it's important that you know, seafarers and companies can look at these websites and engage and collaborate with us, and we can take it forward.
Okay, Johan?
I would say perhaps for me, one of the most important things is building a holistic well-being management system that is based on good relationships with seafarers and between seafarers, and recognizing seafarers as the most key thing within the industry. We are still problem focused to a large extent, And going forward, being person-centered, I would say, for me is key, and also embracing technology to do new and creative things to look after seafarers.
Okay, Athena?
I think the COVID-19 pandemic has taught the world about good hygiene practices and how to avoid contracting different diseases. Today we have COVID-19. In the future, it may be some other type of virus. And I think the fact that people have become more knowledgeable about how to protect themselves from disease is the one thing we can take home with us from this terrible pandemic. Especially seafarers in closed quarters need to be even more aware. So I think this is the positive end of the COVID-19 pandemic for the world and of course for seafarers.
Okay, and Eve?
I agree with what has been said. I think now that finally the spotlight is on this existing problem, we need to grab it and continue working on it. I also believe digitalization of ships needs to continue. We have all agreed that we are able to work remotely and digitally. I think that has to come further to the ships. And my last point would be discrimination of seafarers. Something really has to be done on that.
Okay, thank you all very much. I would like to thank you for your contribution, and for those who are watching us and haven't been able to attend the session from the beginning, the full session, the recording will be available on our YouTube channel. Thank you all very much. And for our viewers, stay tuned for the next panel on the future skills. Thank you.